fall risk management with motivational interviewing. Funding for the Catch Rural Falls program is supported by the Nebraska Department of Health and Human Services Office of Rural Health through the Medicare Rural Hospital Flexibility Program. This content is solely the responsibility of the presenters and does not necessarily represent the views of our funding source. The Catch Rural Falls program is led by Dawn Venema and Vicki Kennel, both faculty in the College of Allied Health Professions at the University of Nebraska Medical Center. I am Tessa Wells, a physical therapist and faculty member in the College of Allied Health Professions at UNMC on the Kearney campus, and am here today to share my expertise in motivational interviewing and communication strategies for engaging patients. The educational objectives for this recording are to explore motivational interviewing as a communication strategy with patients and clients. We will first identify 4 foundational principles of motivational interviewing, and second, describe key communication strategies, or ORs, to engage patients who have fall risk. For the purposes of this content, we are assuming that you have already completed fall risk screening with your patient. For more information on how to conduct fall risk screening, please refer to the video on the Catch Rural Falls website. Using the study algorithm, we can see that after you've completed fall risk screening, prevention, assessment, and intervention are the next steps of patient engagement. Motivational interviewing is a collaborative conversation style for strengthening a person's own motivation and commitment to change. It is a great tool for taking patients from a possible lack of awareness about the issue, for example, that falling is an important factor related to health, to actively doing something to prevent their future risk or decrease their current risk of falling. This often involves needing the patient to commit to some type of change. Whether that change is accepting help from others or needing to make some decisions about home safety, motivational interviewing techniques can help you start these sometimes challenging conversations. To use motivational interviewing, we need to understand the 4 foundational processes of the practice, and then practice using the specific communication strategies to build a patient's motivation and strengthen their commitment. Patients might present with ambivalence or wanting incompatible things at the same time. For example, wanting to decrease fall risk, but not wanting to change anything in the home or go to physical therapy. Ambivalence oftentimes comes from anxiety, which leads to procrastinating about making decisions to avoid anxiety. Motivational interviewing helps to resolve this ambivalence and allows individuals to move into action. The basis for the motivational interviewing approach looks a bit like a roadmap. Engaging is the relational foundation. Focusing identifies the agenda and the patient's own change goals. Evoking uses motivational interviewing core skills and strategies for moving toward a specific change goal. And planning is that bridge to behavior change. While motivational interviewing is a helpful tool to elicit the patient's point of view about their fall risk and what they want to consider for managing fall risk moving forward, when we use this method, we need to work hard to avoid these traps along the way. First, the assessment trap, or bombarding the person with questions. Second, if we communicate that we have all the answers and the patient needs to rely on us for the best way forward, we're falling into the expert trap. The premature focus trap, or talking about change too early, is another thing to avoid. If a patient is not willing or ready to change, we need to address this at a future follow-up. And finally, the labeling trap, or when we place a label on the patient, such as frail or non-compliant. This can produce shame in our patients and really damages the relationship. Essentially, we need to keep our agenda out of the way and work with the patient to hear their thoughts and concerns. Now that we know what traps to avoid, let's take a closer look at each of the 4 processes. We'll start first with engaging. Engaging the patient is the process of establishing a trusting and mutually respectful relationship. We must allow for time to develop a trusting relationship and know that this isn't something that can be rushed. We must listen to understand. It is important in this and subsequent steps to avoid those traps we previously mentioned that would lead to disengaging the patient. Important things to consider in this initial phase are: how comfortable is this person in talking to me? And do I understand this person's perspective and concerns? We want to establish mutual goals and have the client leave feeling hopeful and understood. After engaging the patient, we move to focusing. This is where we help the client to prioritize areas of change and set the agenda. It's important in this step to understand what the person's goals for change really are and what the clinic or provider's goals are for the patient. If the patient's goals do not align with the clinic or provider's goals, we need to hear them out and meet the patient where they are. We need to work to make this feel more like conversational dancing rather than wrestling with the patient to get them to agree with our point of view. In the evoking stage, we want to elicit the person's own reasons for change. We should explore their readiness, willingness, and ability to change, and be mindful of if I'm steering too far or too fast in a particular direction as the provider. Is the patient demonstrating reluctance? If they are, is that reluctance more about confidence or the importance of the change to them? Here, we want to elicit and respond to change talk. So this is where active listening becomes really valuable. Change talk is any language that indicates a patient's thoughts of change, either about their desire to change or their perceived ability to change. Some questions to elicit change talk could be: why do you want to make a change? What are the reasons or benefits for making a change? What would be your first step? Or what options do you have? The final piece of motivational interviewing is planning, where we go from a general concept to a smart plan. It's likely that it'll take several conversations to actually get to the planning process, especially if the patient is experiencing a lot of ambivalence or personal or financial barriers to change. When we're ready to help the patient establish a change plan, important things to consider together are: what would be a reasonable next step toward change? Providers should ask themselves, am I remembering to evoke the patient's perspective rather than prescribe a plan? And am I offering needed information or advice with permission? Here we really want to avoid that expert trap. Goals that are set collaboratively in this phase should be specific, measurable, achievable, relevant, and time-bound. These should be revisited at regular intervals when the patient engages with the interprofessional team. Now that we've seen the overall process to motivational interviewing, let's look at some specific communication strategies to help elicit the patient's perspective. We need to use our oars to get the conversation going in the right direction. Open-ended questions is the O. These are questions that require more than a yes or no answer. Affirmations, or A, are statements pointing out anything positive that you notice with the client, any attempts, accomplishments, any successes that they mention or are aware of are important to acknowledge. Reflective listening is understanding what the patient is thinking or feeling and stating it back to them, not word for word, but in paraphrased statements. If a patient states, "I don't think I have a fall risk," you might respond with, "So you're questioning the assessment." If the patient states, "Well, I've fallen before, but I never get injured," you might respond with, "You aren't concerned about the falls because they haven't caused any problems." Summarizing is taking several statements from the patient and summarizing the main points. Let's see how this might go with a patient who has just screened positive on the 3-question screening. The provider will start the conversation. Since you reported that you feel unsteady when walking and you have had a fall in the last year, this puts you at risk for future falls. How do you feel about that? I don't know. I guess I didn't really think it was an issue. I'm worried now that people will start telling me all the things I shouldn't be doing. I haven't had any injuries or anything. I just don't want people to overreact. I appreciate that you shared your experience with us today. Now we can work together to avoid further falls. First, I want to acknowledge that you're worried that people will start limiting you now that there's been a fall risk identified. Well, yeah. I know that I've fallen before, but I don't want everyone to start to worry or make me move. I can still do a lot of things, and I don't want to be a burden. I don't want this to be the start of losing my independence. But I also don't want to fall and get hurt and then not be able to take care of myself, or my dog, or my garden. Let me make sure I have this right. You know that safety is important and you want to make sure that falls don't continue to happen or cause an injury, but you want to maintain your independence and be able to do things that are important to you, like continuing to garden and take care of your dog. Is that right? Hopefully you can see how each of the conversational oars were used for open-ended questions, affirmations, reflective listening, and summarization. In summary, motivational interviewing is one communication strategy to engage patients where the key is partnering together to identify the patient's priorities, help them to identify areas that they want to change, and then assisting them to come up with a sustainable plan to get to the goals that they want to achieve. Open-ended questions, affirmations, reflective listening, and summarizing are 4 simple ways to start talking about change. You can use your oars and start paddling. Links on this slide will take you to information from CDC's study or further information on motivational interviewing. That concludes the recording on motivational interviewing. Thank you for listening.